Right. Hello and welcome to 2.3. Today we're going to list the drugs that affect the nervous system, most specifically the central nervous system. All right. Of course, the nervous system is comprised of two main systems, the peripheral nervous system, which we're going to cover in detail next week, and the central nervous system that we are covering this week. Together, the CNS and PNS transmit messages throughout your body that instruct you to do essential functions such as breathing, moving, smelling, thinking, seeing. The nervous system also performs things like controlling your heart rate, releasing hormones, regulating your digestion, protecting neurons and neurotransmitters, and influencing your behavior and emotions. Both recreational drugs and those prescribed for medical reasons impact the nervous system. The CNS in particular is impacted strongly by drug use. Alcohol, cocaine, heroin, amphetamines, cannabis, nicotine, immunosuppressants, anti-epileptics, nitrous oxide, sedatives, and prescription pills are known to be the worst offenders. CNS stimulants such as cocaine speed up the transmission of messages sent throughout the body. CNS depressants such as alcohol slow them down. Hallucinogenic drugs distort the messages sent between neurons, leading to the psychedelic high that many people experience while on hallucinogenics. What's also kind of cool is that they have found ways to stimulate the brain to make you hear the voice of God or to have a religious experience, to believe that you are seeing and hearing angels as well, linking that to certain neural pathways. So that's pretty cool, sort of along the line of a psychedelic high. All right. The pleasure centers of the brain, which receive neurotransmitters like dopamine, are affected by drugs, no matter what type of drug you are abusing. As drugs enter the nervous system, they affect which messages are being sent, as well as their transmission rate. They could slow you down or speed you up. People become addicted to drugs because intense messages of pleasure are rapidly released by the nervous system into the brain. All right. Everybody wants a good time. That's the same thing with endorphins. You know, that's a pleasure chemical in the body. I don't know if you've ever heard of the runner's high. People that are exerting their bodies or in pain from jogging or running long distances, their bodies will release endorphins, causing a high, literally a high. They get very euphoric and giggly sometimes. It is called a runner's high, and people will become addicted to running because they want that endorphin release. The short-term effects of drug abuse on the nervous system vary from person to person, and of course, depending on which drug you're using or abusing. And in general, you can expect to experience physical and psychological effects that will subside once the drug wears off. This means that you're only using it once or twice. But these effects can also lead to dependency with extended use. Short-term effects of recreational drugs on the nervous system vary according to the type of drug. So we're going to talk for a minute about cannabis. A lot of relaxation is one of the major side effects for the central nervous system. Altered perception, increased heart rate. All right, so if you have tachycardia, some strains or all strains of cannabis are not for you. Low blood pressure, anxiety, and paranoia. I think I brought him up before in another class, but my stepdad, while he was dying of colon cancer, desperately needed something to boost his appetite and ease his pain and calm his anxiety. Marijuana was not it. He is one of the people that gets extremely paranoid. I'm talking peeking through the blinds 23 hours a day to see what the neighbors are doing, kind of paranoid. It would be hilarious if it wasn't so sad. Difficulty concentrating is another issue. It is befuddling the messages getting to and from the nervous system, sometimes with cannabis. Cocaine increases your energy, increases your alertness and feelings of happiness, lowered inhibitions. Increased confidence. All right. So not only do you care less about what you're doing, you're more confident doing it. And overstimulation of the heart and nervous system. You're going to be more susceptible to sensations. And if you have cardiovascular problems, you're looking at the risk of seizures, strokes, or heart attack. If you are not in the best of health, one hearty dose of cocaine could literally be fatal to you. Ecstasy, it falls in with other psychedelics, but this particular one increases alertness, talkativeness, amplified intensity of sounds and colors, anxiety, confusion, paranoia, increased body temperature, sweating, heat, all right? Dehydration, of course, you're overheated and you're sweating. You are going to dehydrate easily, especially if you are not drinking. And some products take more water to process than others. Like if you're eating lipids, which are fats, sugars, your carbohydrates, and proteins, and you are dehydrated, proteins take more water than anything else to process in the body, and you will dehydrate yourself faster by eating proteins. Speed, increased confidence and energy, increased alertness, reduction in appetite, an increase in agitation and aggression, confusion, paranoia, high blood pressure, leading to potential heart attack. Your nervous system just keeps sending those speed signals to that heart until it literally blows up. Crystal meth, feelings of pleasure, increased confidence, amplified alertness and energy, sense of itchiness, which leads to a lot of face picking. You can see the results of this in these images here. Dilated pupils, dry mouth, excessive sweating, increased heart rate and breathing, reduction in appetite, and a very high increased sex drive. Meth is extremely addictive and will not only manifest in facial sores because of the itching and the fascination with picking at the skin, but you get rapid tooth decay. Part of that's from that drying mouth and not being able to wash away that bacteria. Gum disease, prematurely aging the skin, and absolutely destroying and atrophying these facial muscles, which can make you look a couple of decades older than what you actually are. I think these images say it all. You can look literally over a 5-year period in these images. She looks like she's aged 35 years, and it's only been 5 years. It's incredible. All of the above short-term side effects of drug use vary in intensity depending on your personal response to drugs, which drugs are being used, and how much of each drug is being taken. Once the effects of the high wear off, the side effects will likely wear off as well. It is possible, however, to experience more serious side effects, such as overdose, with any level on drug abuse. All right. If you're taking a CNS depressant, that represses some of your respiratory signals, you could literally die. You just stop breathing. All drugs pose a risk of overdose when abused for recreational purposes. Drugs that directly impact the nervous system are particularly dangerous, as involuntary actions like breathing, which I just talked about, and heart rate can be affected. Additionally, your risk of overdose increases greatly with polydrug use, or using multiple drugs at once. All right. With CNS depressant drugs, overdose is common. They are known to impair cognitive function as well as suppress vital functions such as breathing and heart rate to the point of death. CNS depressants slow your brain activity. CNS depressants such as opioid painkillers that your doctor gets you started on serve important medical purposes when taken in low doses, but we have a massive opioid epidemic. And I can't stress enough, even my own personal doctors have offered me opioids extremely irresponsibly, even though I am an NSAIDs girl. I like Advil is my go-to for an anti-inflammatory and for pain relief. And I am absolutely shocked at the amount of opioids that are offered in this country, but that's a side story. If doses are too high, or if these drugs are combined with other depressant drugs such as alcohol, the risk of a potentially fatal overdose is massive. These CNS depressants are often abused for recreational purposes and frequently seen in overdoses. Opioid painkillers, sedatives, alcohols, hypnotics, and tranquilizers. All right. The combination is stronger and more unpredictable and deadly when you combine things. They are greater than the sum of their parts. All right. It is compounded when you take them together. The nervous system becomes overwhelmed by messages to slow breathing and heart rate, and it may stop your heart or your breathing altogether. This is the case of 1 + 1 equaling 3 or 5. 1 + 1 does not equal 2 in this case. They are compounded. Long-term damage to the nervous system. A recent study found that patients who were treated for an overdose due to CNS depressant drugs were significantly impaired in the following domains compared to the control group who had not experienced an overdose. So they're looking at CNS depressant users across the board. One group did not have an overdose and one group did. Those who had suffered an overdose had prolonged reaction times, meaning if you're driving a car and someone walks in front of it, you may already hit them before you realize that you need to hit the brakes. Poor working memory and planning. You have very little cognitive function happening there. More impulsive decision making. Oh, yes, I will purchase this ridiculously expensive thing, forgetting entirely about your electric bill. Poor performance on tasks with increasing complexity. So you could probably do 1 + 1, but 1 + 1 + 7 + 8 - 6 × 2 is going to leave you befuddled and confused and unable to function. Research has found 3 main ways that certain drugs, such as methamphetamine, can cause psychological and biochemical damage to the brain and nervous system. Long-term damage includes acute changes to the neurotransmitters. I'm going to talk about that in a minute in detail. Rewiring of the brain's reward system, death to brain cells. Long-term exposure to drugs that alter neurotransmitters and brain cells cause irreversible damage. However, most of the brain dysfunction is likely to be reversed with complete abstinence over time. Damage to the nervous system is not likely to heal quickly, and it takes up to 18 months of sober living for people to make a full recovery if they are capable of a full recovery. All right, so there's some images here. The bottom one, there's a healthy brain, and then there's the diseased brain of a cocaine addict. This top one is also a cocaine user. You can see the healthy subject on the far left up at the top there. They have healthy dopamine receptors, the chemical that is task-oriented, that makes you motivated to do things, because every time you work towards completing a goal, you get some dopamine, which helps in executive function. All right. After 1 month after cocaine use, after stopping cocaine use, you can see there's just barely a blip in there at all. They have almost no dopamine receptors activating at all. After 4 months of no cocaine use, there's a slightest hint of tangerine in there, where they are finally starting to just get the tiniest piece of dopamine going on. Additional symptoms of prolonged drug use on the nervous system that are not associated with overdose per se, but just over long-term use, is memory loss, depression, anxiety, vein and tissue damage, and getting infectious diseases with injected drug use, weakened immune system, and changes in the brain's reward system, which is what we're talking about with these dopamine receptors dying. The above physical and mental health conditions are likely to occur with extended use of any substances that interfere with the normal functioning of your nervous system. These conditions are often progressive and get worse with continued or more severe drug use. Many of these conditions can be treated after the drug is stopped. Mental health issues such as depression and anxiety are extremely common with people with extended drug use. I would also go so far as to say they probably had mild depression before they started and may have been self-medicating to get those dopamine hits, perhaps with drugs, rather than seeking proper medical care, because who knows, money issues, cultural issues, the American healthcare system, take your pick. Abstinence, the complete stopping of the use of drugs, coupled with appropriate counseling, can alleviate most of the mental health symptoms. Appropriate medical care can improve weakened immune systems, such as like immunotherapies, and treat or monitor medical complications that arose as a result of drug use. So in this image on the far left, we have a healthy brain. And on here, we have a methamphetamine user. 1 month of complete abstinence. You can see they have limited function going on there, limited firing. After 14 months, so a year and 2 months of complete abstinence of drug use, they are getting closer, but they're only halfway there to the healthy control. They are still struggling with that brain. So I would say at 18 months, this person probably still won't have a full recovery from the looks of the progress. Reversing damage to the nervous system. So with time, damage to the nervous system is expected to reverse itself in most people, hopefully. The extent and duration of drug abuse and how the individual's body responded to drug abuse impact the recovery period, obviously. Fortunately, you can have some interesting repairs of the central nervous system. You can work on it whether they've had injury due to neurological disease or to substance abuse. It is possible to repair some damage. There is cell replacement that is being done. And remember, the neuroglial cells can replicate and help replace themselves, but neurons cannot regrow. Reconstruction of damaged neural tissue, however, can happen, as well as rewiring of the CNS and the use of medication. So this image is really cool. So this is like a wiring, a brain mapping of all of the messages being sent in the brain. And if you have some neurons that are actually dead, you've had brain cell death, your healthy ends of some nerve cells will reach out to go around and connect to other cells around the one that is deceased or atrophied, and you are able to rewire, connect new pathways. It's like building a new road. When one gets washed out by a flash flood, you can always pave a new road in your brain. Which leads me to neuroplasticity. It is the brain's secret superpower. Neuroplasticity is so absolutely cool. If anybody has ever seen like a really interesting video or anything on neuroplasticity, share it with me so I can share it with the class, because this is super cool. I'm only going to do a little brief blurb on it though, because I know this is massage class and not brain class. But neuroplasticity is amazing. All right, that is the brain's ability to form new connections in response to the experiences it encounters. There is a high potential for neural recovery. This is also for things like PTSD, okay? Neuroplasticity is the brain's way to compensate for injury or disease. New pathways are formed as healthy, undamaged nerve endings grow and connect with other healthy nerve cells. It is defined as the ability of the nervous system to change its activity in response to intrinsic or extrinsic stimuli by reorganizing its structure, functions, or connections after injuries, such as a stroke or traumatic brain injury, otherwise known as a TBI. When you do your health intake, if you see TBI, it is almost always traumatic brain injury. Remember that, TBI, traumatic brain injury, TBI, traumatic brain injury. All right, that is all I have for you today. Have an absolute excellent evening. If you have questions on any of this material, please feel free to reach out. I don't think it's super extensive on the MBLEX about drugs that affect the central nervous system. I would be shocked if you had more than 2 questions about that topic, to be honest with you. So I want you to know it. You need to know it for the health and safety of your clientele that is coming in, especially if they're on opioids. You need to know if they're on any type of stimulants or depressants when they are on your table. Other than that, have an excellent evening, and we will see you guys for the next one.